Okay, let's dive into this. Welcome to today's explainer, where we're tackling something absolutely crucial: demystifying ischemic strokes. We're going to look closely at the exact mechanics of what happens inside the brain, and honestly, more importantly, how we can practically prevent it from ever happening. But before we get into prevention, I want to ask you something. What actually happens inside the brain during an ischemic stroke? Right? We hear the term tossed around in the news and at the doctor's office all the time, but picturing the actual mechanics, well, it can be kind of tricky. So today, we're taking a little journey together. We're going to start way deep down inside the blood vessels of the brain and then work our way out to the everyday lifestyle choices that you and I make. Section 1, Understanding Ischemic Strokes. And this brilliantly illustrates what we're talking about. An ischemic stroke, at its very core, is basically a critical plumbing issue. A blood clot, what doctors call a thrombus, forms and physically blocks the flow of blood right there in the vessel. And when that crucial plumbing system completely fails and the blood supply gets cut off, the affected area of the brain suffers immediate, severe damage. Moving on to the anatomy of anoxia. So let's unpack that word we just used, thrombus. It's simply a blood clot that forms inside a blood vessel and just gets stuck there, blocking blood flow. Think of it like a massive, total gridlock traffic jam on a major highway. The thrombus is a literal roadblock. Nothing is getting past it. All those essential, life-giving supplies that your brain absolutely relies on are suddenly just trapped behind this totally immovable barrier. Which leads us directly to our second key term, anoxia. Anoxia is the severe lack of oxygen in your tissues, and it's caused directly by that blocked blood flow. Because that thrombus roadblock is stopping fresh blood from circulating forward, the affected brain region is literally being starved of oxygen. And here's the really scary reality. Without oxygen, brain cells can start dying within mere minutes. That rapid cell death is exactly what causes the devastating clinical event that we call a stroke. Next up, the pillars of prevention. Okay, time for the good news. We can actually break stroke prevention down into 6 distinct pillars. To keep it simple and avoid cognitive overload, let's group these logically. First, we've got our action-based pillars, things you actively do, like eating a healthy diet, maintaining a healthy weight, and getting regular physical activity. Next is our medical pillar, which is managing chronic conditions. And finally, the subtraction-based pillars, meaning things you cut out, limiting alcohol and refraining from smoking. Put them all together, and these 6 habits form a literal protective shield against that dangerous clot formation. Let's zoom in on managing chronic conditions. So the crucial point here is that managing chronic health conditions, specifically things like diabetes and hypertension, is absolutely non-negotiable for prevention. Why? Well, because high blood sugar and high blood pressure actively damage the delicate inner lining of your blood vessels over time. By staying on top of these 2 specific conditions, you are quite literally keeping the plumbing clear. You're preventing the exact environment that lets that dangerous highway-blocking thrombus form in the first place. Now let's talk about habits to break. We've got a really clear juxtaposition here. On one side, there are proactive habits. Things you consciously add to your day to build health, like a colorful diet, watching your weight, and getting that daily physical activity. On the flip side, we have the habits you need to actively avoid. And honestly, doing less here gives your brain so much more. You've got to limit alcohol usage and firmly refrain from smoking. Smoking, especially, makes your blood much more likely to clot. By just cutting these negative factors out of the equation, you drastically drop your stroke risk. So, here's a really important question for you to ponder right now. Which of these 6 prevention pillars are you going to focus on today? Is it maybe swapping out a heavy snack for a healthier option? Finally, taking that brisk walk you've been putting off? Or maybe it's calling to book that doctor's appointment to check your blood pressure. The power to prevent that microscopic traffic jam in your brain literally starts with the very next choice you make today. If you found this explainer helpful and empowering, please hit that like button, share it with someone you care about, and subscribe. Oh, and don't forget to press the bell icon so you never miss a structured breakdown just like this one. Also, if you're looking for expert care, be sure to check out Dr. Gangadhar Physiotherapy and Rehabilitation Center over in Amirpet. You can easily reach them at +91 868 105 177 or just visit their website at dgpc.uneweb.com for some top-notch physical therapy and emergency pain relief treatments. Thanks so much for learning with me today. Remember, preventing a stroke isn't about having perfect health overnight. It's about the very next choice you make today. So what's it going to be? I'll see you in the next explainer.